On to health insurance today on radio. And joining us in the studio today to discuss understanding common eye conditions is Dr. Chidi Patrick, an optometrist from Beraka Eye Clinic right here in Lagos. And he is also the acting public relations officer of the Nigerian Optometric Association, Lagos State chapter. Dr. Patrick, you are welcome.
Thank you very much.
So tell us, what are some of the most common eye conditions affecting Nigerians today?
Okay, thank you very much for having me today. I'm so glad you invited me here today to discuss this.
Yeah,
so
welcome.
Some of the common eye conditions Nigerians battle with include refractive errors, and refractive errors are conditions where the eye, when relaxed, are unable to bend light correctly into the eyes, onto the retina. This brings about distortions of blurry images for the individuals. And some of these conditions include myopia, hyperopia. Some persons may call it hypermetropia or long-sightedness. Then we have astigmatism, presbyopia, and then aside this, we have cataracts, we have glaucoma, we have dry eye syndromes, we have age-related macular degeneration, diabetic retinopathy, corneal opacities or corneal problems, and so there's so many of them. These are some of the basic conditions Nigerians suffer.
Wow, so much. So in all of these that you've mentioned right now, what are the common symptoms of these conditions that people should be aware of? What are the symptoms? That indeed I have a eye problem or something.
Okay, the commonest of them is blurry vision and photophobia or sensitivity to light. Then we have difficulties, what we call squinting. When someone is trying to see very clearly, he squeezes his or her eyes. Then there is headaches or eye strain. There's also difficulty seeing at night. Some of them also come in form of pain. So those are some of the basic symptoms.
So if you notice all of those things, that means you have eye problem?
Exactly.
Wow. Okay, Dr. Chidi, tell us about the risk factors. Are there risk factors for some of these conditions?
Of course, there are risk factors. These risk factors are basically genetic in nature. Some of them are age-related, and some of them are due to prolonged exposure to maybe UV radiations. Then for children, for instance, increased screen time could be a risk factor. Poor diet or poor nutrition could be involved. Then health challenges, for instance, in diabetes, could be a risk factor. Yeah.
Wow. So in all these, risk factors you've told us, are there specific age at which one can have the, these eye conditions, problems?
Most eye conditions begin to manifest usually at age 40 or higher. These risk factors are usually higher when one is over the age of 40. There's a study that says some persons at 60 are 8 times more prone to eye conditions or eye problems than their younger counterparts.
But Dr. Chidi, I've seen little children also with eye conditions.
Of course.
How about that?
Yes, little children come up with eye conditions. Of course, we're in the age where children are going back to school. So some of these children inherit some of these conditions.
So they're genetic.
Yes, that's where the family history comes into play. Now, we are also aware that some of these children also are exposed to increased screen time. Some of them play, a lot indoors. Some have fewer friends. For instance, if a child who doesn't have more friends, for instance, may not know the reason for that. Maybe because of his or her vision.
Wow.
Because imagine a scenario where a friend is waving at you from afar, and because of your inability to see that person, you're unable to return the favor. And that other person feels like you're snobbish.
Yeah.
And so most of them tend not to have friends. So family history comes in.
Okay.
Children are also prone to a lot of eye conditions too, depending on what they are exposed to.
Wow. Thank you so much, Dr. Chidi Patrick, for that insights. But right now, all right, Dr. Chidi Patrick, talk to us about the economic impacts of these eye conditions. When we talk about economic, we're talking about money here. So how would you say these conditions affect people's daily lives in terms of their socio-economic impacts?
Okay. You see, vision is so important that when it's absent, it hinders the ability to make money. So basically, it reduces productivity when you don't have vision. And then when you don't have at all, you can imagine there's nothing you can do about it. Although there are people without vision that can focus on other aspects of life. But basically, your life is now, half of your life is more like to channel your, is channeled to other areas.
Okay.
Now, some of the impacts include, for children, hindrance, low academic performance. Then we have increase in the risk of accidents for drivers, and the overall quality of life is also affected. Take a look at somebody who has lost his vision. He can't see. I once had a patient who complained that he is old, he has lost his sight, he can't see his grandchildren, he can't see the color of the food he eats, he doesn't even know whether the person feeding him likes him.
So sad.
So that actually affects the lifestyle. Then for children, we've also discovered that it affects, it creates anxiety. There are some disorders that can come up as a result of loss of vision, for instance. Anxiety can come in, depression can come in. Some people live in pain. They are not always happy. So their quality of life generally is affected in everything they do.
Wow, Dr. Chidi, what you mentioned right now, it's such a pathetic situation. So in all of this now, are these conditions, eye conditions, are they prevented? Can they be prevented, basically? And how often should individuals go for eye checks? Okay,
great. These conditions greatly can be prevented. A statistic shows that 80 to 84% of visual problems are avoidable.
Wow.
Yes, they are avoidable. So how do we